Hello students, welcome back to the third panel discussion today. And here we are in the supposedly honeymoon period of MBBS. That's a third year, and we are with wonderful faculties of third year. So I am honored to introduce Dr. Jagadish, who is an ENT professor, who will be taking ENT with us, and Dr. Sudha, who is an ophthalmologist, Dr. Manjunath, who is a legal expert of our team, and Dr. Murugan, who is going to take care of entire thing in the community. So let me give a little bit of introduction from their end. Over to you, Dr. Jagadish.
Hi guys, I'm Dr. Jagadish, and I'm an ENT surgeon, and with the ENT I'm also an entertainer, so I do some stand-up comedy. And with that same ENT, I'm also enterprising entrepreneur, so I've done some medical devices. I've also authored, but one thing that I did not do for a long time is to teach, and that's why I thought I should explore that as well and teach on this platform. And I thank Physics Wala for giving that opportunity.
And thank you, Dr. Jagadish, to be a part of us. So we have an amazing, multi-talented, multifaceted personality here, and I hope that we will learn ENT in a very, very fun way, and also in an interesting way, putting all his background into perspective. Dr. Sudha, your introduction, please.
Hi everyone, I am Dr. Sudha. I am MBBS from Medical College, Kolkata, and MS Ophthalmology from Maulana Azad Medical College, New Delhi. And I have been mentoring students for the past 12 years. And it is really an exciting opportunity here. I'm really very glad to be a part of this PW Meded family.
Thank you, Dr. Sudha. So with practicing in 2022 or going forward, I am sure that there's going to be lots of medical legal problems you might face in future. And to have a very basic foundation of it, we have a legal expert with us, Dr. Manjunath.
Hello everyone, I am Dr. Manjunath. I'm the FMT guru. I'm teaching forensic medicine since last 10 years. I completed my MD from Maulana Azad Medical College, New Delhi.
Thank you, Dr. Manjunath. So here we have Dr. Murugan with us, who is going to be teaching entire thing about the community. I'm sure most of you guys must have got the attention about community medicine with and when COVID became a huge problem. So understanding epidemiology is very, very important, not just to beat COVID, also to beat you next. Over to Dr. Murugan.
Hi everyone, I am Dr. Murugan. I teach community medicine. We call it as preventive social medicine. So I teach currently working as a head of the department in a medical college near Chennai. I'm teaching this coaching class for almost 10 years. So I'm happy to be part of the team of Physics Wala.
Thank you, sir. So we have quite a good set of questions from medical students all over the country, and our panel of faculties will be very delighted to answer them. The first question is to Dr. Jagadish. So how important is ENT from a perspective of NEET PG or next, or as a doctor?
Yeah, see, I did not realize this until I did ENT myself, but I realized that ENT is actually a very important subject. I'm not belittling other subjects, but just generally, as a doctor, because ear, nose, throat are very common entry points for most clinical conditions, and we have 1.4 billion people who sneeze or have a cold, sometime or the other in their life. So whatever field of medicine you take, you are going to interact with people with ENT. And as a subject, ENT is in the crux of connections. That's why they're clubbed together. There's no random reason why ear, nose and throat are together. Ear, nose, throat, head and neck are all connected. And for that reason, when questions are asked to you, even though it might not seem directly that it's from ENT, it could be from a lot of things that it is close to. Like, without any offense to my ENT fraternity, I call or consider ENT as the cancer of the medical field, because we have invaded everything around. Like if you look at the ophthalmology, we're doing orbital decompression, dacrocystorhinostomy. For neurosurgeons, we have gone skull base through the sphenoid. We are doing pituitary adenoma surgeries. We've come to dentists and we're doing, a lot of maxillofacial surgery. If the nose is not good, we do plastic surgery, rhinoplasties and all of that. If you come a little more down, we are doing gastric pull-ups, we are doing tracheal resections. And if you don't want to do surgical things, we have entered obstructive sleep apnea and pulmonology, allergy, vertigo, right? So there's a lot of things in, that questions can come from what is associated with ENT. And not only with that, this subject itself has got too many dynamics in it. Like it has open neck surgery, it has endoscopic nose surgeries, it has microscopy. So it has all three kinds of skills. So it's quite complex. It's not easy to understand. And many people say 30 years honeymoon period, but you don't know that there are 5 subjects put in call as one subject for you. And then you realize that later on. So I think don't look at 10 questions, 15 questions. ENT is an entry port for most conditions, and it is also connected to a lot of other systems. And somewhere or the other, this forms a basis of the concept for many things. So I think that's why it's important.
Thank you, Dr. Jagadish. I think it's no one can put the importance of the subject of ENT better than Dr. Jagadish, and I hope he helps you to breathe well without any sneezes or allergies towards ENT.
No hiccups.
No hiccups as well. And if there is any hiccup, we do have a surgeon who can take care of that also. So next question to Dr. Sudha, what will be the weightage of ophthalmology as a subject when we move towards the next pattern?
Well, as of now, in this NEET pattern, we are looking at opthal. Students look at it mostly as a short subject, expecting like about say 12 to maximum of 15 questions from it. But when we move, if and when we move to the next pattern, opthal becomes far more important. Like we are expecting something like about 60 questions. So you understand how the weightage is going to increase. So this means that almost every topic in opthal becomes important, and we have to do every topic properly, and we really cannot leave out anything in opthal. So it's going to become that important. That is maybe the bad news, but I'll also give you the good news. See, among the clinical subjects, as far as the undergraduate curriculum is concerned, opthal has got a very, very well-defined curriculum. So it is also something which can be done and finished and done well within a finite period of time, which also means that it is going to be very scoring. Out of the clinical subjects, if you do this well, you can be reasonably assured that you'll do well in this. So that is how the weightage of opthal is going to change when we move to the next pattern.
Thanks a lot, Dr. Sudha. The primary focus when we move to NEET to next is the first and the foremost agenda for all of the teachers at PW is to make sure the students are not afraid, because there's lots of FOMO going around. There's lots of problems that will I be able to clear it or not. First, let's learn the subject. Let's understand the subjects, and the clearing the exam or acing the exam is definitely a byproduct of understanding medical science at the end, right? So we'll go to next question to Dr. Manjunath. So what do you think will be the importance of FMT in the upcoming NEET PG, which is just 1 month down the road?
Yeah. In last year NEET PG exam, they asked 15 questions from forensic medicine and toxicology. So what I observed, all 15 questions are relatively easy. If you concentrate for at least 2 days of our classes, you can answer at least 14 out of 15. So I always tell my students, so one is hard work, the second one is the revision, and the third one is the analysis. The analysis means you can practice some previous year questions just before the exam.
Okay. Thank you, Dr. Manjunath. I would just like to add that you cannot twist a question in forensic medicine. Law is always black and white. There's no gray area. It's neither like medicine where I can create a scenario complicated. You learn forensic medicine, the question is going to be straightforward, and definitely there's a very, very high chance of scoring better in an exam. Fine. Next question is to Dr. Murugan. What do you think will be the focus of PSM in this NEET exam, and what do you think and how the students should change the focus when it goes to next exam?
So as of now, the PSM subject is start right from first year, second year, and third year, even during internship. So the council or NMC, they wants the doctor to be a primary care physician. That's why they are giving more emphasis on PSM. So in this context, so usually what happens is that 10% of question, even as of today, NEET exam is 200 question means, so you will get around 20 questions you will get. And most of the questions are directly comes from textbook, so which you can easily focus. When it goes to next exam, the same weightage has been applied. Okay, they said that 10% of questions will come. This is what they have given as of now. So 10% of weightage is given. So that is also easily linkable with other subjects. Okay, the PSM is easily linked with OG, is easily linked with pediatrics, for example, programs, medicine, communicable disease. So after all, we have programs. So this incorporation will be there. So content is same, but we have to just see the approach only. We have to modify it. Thank you.
Thank you, Dr. Murugan. I think the focus of be it PW or be it any teacher or be it the government here is to make sure the undergraduate knows the 90% of the diseases which will be frequently seen in the community, rather than going behind the very, very exotic syndromes. Those might come in exam, but that's not going to help to ace the exam, nor in your routine practice. You're going to just see the basic things repeatedly again and again. And PSM is the best subject to put the focus onto the most common things which you're going to see as a doctor in future. And I think Dr. Murugan will definitely implement whatever is there in the community, and he'll definitely share his thoughts on that. Going back to Dr. Jagadish, and I think the question is also how to make ENT learning more interesting. I think your answer will make it more interesting, or will the subject be? I'm just waiting for your answer.
Well, ENT is a very complex subject because it looks very simple from the outside. It's very complex in the inside, and most of us don't even know how complex. If I ask you what's the direction of the nose, most of you will point like this. You don't know it's like this, right? So the only interesting and meaningful way to understand a subject like ENT is visual. To be able to see what's actually inside the nose, what's actually inside the ear, and actually inside the throat, to have a very good understanding of what it is, right? These diagrams, I have many times assumed by looking at these diagrams in the book of vocal cords and all of that, but when you see the actual image, when you put an endoscope, you're like, acha, aisa dikhta hai, it's like that, right? It's very different from what you see. And I think that's why ENT is a bit challenging to understand, and that's why sometimes you forget a lot and you end up, learning by rote. But what I would advise you to do to make ENT learning interesting is that get hold of an otoscope or get hold of an endoscope, and when you're there in your clinical postings, ENT is studied more by being with the patient and seeing actual things. And a lot of these ENT doctors, even if you go to your professors or faculty, they would have stored a lot of videos, a lot of photos, a lot of endoscopy images, surgical videos of things that they would have done which are interesting. Seeing that visually and then reading about it will make it easier for you to understand. Of course, I've been given some liberty to add humor with ENT in my teaching. I did try it out as well. I did the politics of the nose as a stand-up comedy using political comedy. I was explaining the anatomy of the nose, and then I was banned from that club, and then I had to be taken back from there. But physics wala is brave enough to allow some comedy in ENT, but I will try to do what I can. But otherwise, my job is going to be to give you as many visuals as possible, as much of what it actually looks like, and that is the most interesting way to study ENT.
Great. I'm sure most of the students might be waiting for this lecture. Just give us a month or two. You will have a fun-filled ENT, and hopefully without touching any of the nerves. And you will definitely be able to ace the maze of temporal bone.
So don't worry about that. My job as an ENT surgeon is to not touch nerves.
Yeah, it's implied.
Yeah.
Fine. So next question to Dr. Sudha. How do you think an aspirant has to prepare for IBQs, particularly in ophthalmology, keeping in mind that fundus is something which an undergraduate don't get to see on a regular basis. So an image of fundus comes in an exam, how he or she should be able to understand it, to able to solve the question.
Okay, so this is like a question that a lot of students have in mind, given the fact that the clinical exposure to posterior segment examination in undergraduate is close to nil. So we don't learn to use the direct and indirect ophthalmoscope in our UG days, but in the exams we are getting fundus images. So I always say that there are two ways to ace an exam. One is by real hard work, that is you go through all the images, memorize them, and find out every intricate detail about them. There is another way, which is probably the smarter way. And that is that most images will not come just as images. There will be like some clinical history, some telltale words in the question, which will kind of guide you to the answer, even if you do not know what the image is. So what you do is you read that clinical question carefully, try to find out these finer points, which you can learn from your previous year's MCQs and PYQ topics. Then look at the options, then narrow down on one or two options, and then try to verify this option by looking at the image. I think that is probably a smarter way to answer these questions, because hard work is important, but given the level of competition and the volume of the syllabus, smart work is probably more important. So this is my take on this. And of course, as far as the important images are concerned, like we are going to come up with a crash course the next month, which is called as Sprint, and in that I will be going through the important ophthal images. So that will help you. But apart from that, this I think by doing a smart retrograde analysis, you can approach IBQs in ophthal.
That's great. Well put, Dr. Sudha. Like Dr. Sudha said, you look for pointers. Don't focus on the image. Look for the pointers in a 5 or 6 line question. One word definitely can clinch your answer. Painless loss of vision, painful loss of vision. That word is what you're going to look for. Same thing what you're going to look for in a real life in a patient, that key important history. That will definitely help you ace the IBQs. So the next question is to Dr. Manjunath. How do you approach forensic medicine as an MBBS subject, like how to learn and how to ace the university exams?
See, most of the questions in forensic medicine, they are straightforward question. Like example, in university exam, the question asked is, what are the autopsy findings seen in case of drowning? The answers are straightforward. So, like example, cadaveric spasm is the one of the surest sign of antepartum drowning. So, if we prepare notes in our classes, our lectures, that is more than sufficient to answer any type of question in any exam.
Thank you, Dr. Manjunath. I still remember my days of forensic medicine. We didn't have a very good guide in our college, so we have to read the entire forensic medicine textbook in the last 10 days. I hope you won't be requiring to need that. We have Dr. Manjunath here to definitely help you ace the exam and to continue helping you, be it NEET or next or FMG or USMLE, whatever you're going to target for. Fine. So next question is to Dr. Murugan. PSM is vast. Like everyone knows that there are lots of topics. For the upcoming NEET PG exam, what topics will you suggest a student to focus on?
Usually what happens is PSM, we have mostly only one standard textbook. So 95% of the questions usually come from that standard textbook alone. So where they focus, the question they don't do it in a very particular area, the more questions will not come. Usually what they do nowadays, in the last few years, what I have seen is they are giving questions evenly over all the content of the book. But that two areas of public health importance, for example, so disease, public health important disease, you focus. So last year we had questions related with TB. We had questions related with malaria. So the common areas, for example, epidemiology, so maternal and child health, those areas, what we do in the programs, what we do in the community, what government does. So those are the real life areas where it is being more used. Those areas questions come. I hardly see nowadays questions which are very rare because now they focus mostly on must know areas they are focusing.
Thank you, Dr. Murugan. So it's more about practical application, be it any subject from anatomy to radiology. We're just going to focus on practical application. That's what everyone as a team of PW want future doctors to do as well. So focus on the areas which is practical application in PSM or any other subject. Definitely that's going to be a winner for all of you guys in the exam. So just to the last segment of this panel discussion, let's ask all the faculties what a student can expect in their PW sprint session. We'll start with Dr. Jagadish. Tell us please in brief, like what do you want the students to expect? And if you want to prepare something for your PW sprint session, please let us know.
Yeah, so I think how I'm seeing the trend now with NEET PG and also with upcoming next is things are going to be more clinical. So what I'm going to try to do in the sprint is give you that clinical perspective because many questions in ENT are coming canvassed in clinical scenarios. So a lot of visuals, a lot of actual conditions, a lot of visual of the anatomy and a lot of visual clinical scenarios is what I will focus with because a lot of the other basic things you probably would have already covered so far. So the revision would be taking all that knowledge and putting it into clinical application in the sprint in ENT.
That's great. Dr. Sudha, what a student can expect from your session?
So in this sprint session, what I'll be doing is, just as Dr. Jagadish said, I would also be doing clinical case scenarios integrated with images. And also I will be doing the PYQs and the PYQ topics because I feel that in this the main strategy of revision in this last phase should be focused on previous year's questions and the topics. Like even if you don't get the same question, it's the high likelihood that you'll get the same topic. So that's what you can expect from Ophthal, clinically and integrated image-based questions and PYQ topics.
Thank you, Dr. Sudha. Dr. Manjunath, what the student can expect in your PW sprint session?
So what I observed in last exam, they're asking more questions from the image-based questions in forensic medicine. Like example, there was a question, image was given and the postmortem hypostasis was cherry red color. The question was, so what is the poisoning in the below case? The answer is very simple. Answer is carbon monoxide poison. So like that, there are many questions in toxicology also. They are also very commonly asked. Like example, last year exam, abrus precatorius is the question asked. So I'm going to cover all image-based questions and previous year questions and also some important topics in each chapter in forensic medicine and toxicology. That is more than sufficient for the upcoming exam.
That will be a great holistic approach to forensic medicine for the NEET exam. And Dr. Murugan, what students can expect from your PW sprint session?
So usually in the subject of PSM, we have some 60 to 80 topics are there, which the previous year questions, the topics which usually they focus. So those areas along with images, along with epidemic, some calculations, those things we will cover in this PW sprint session.
Thanks a lot, listeners for patiently listening through the entire session. And be ready. We'll be announcing the final year faculties, both the major and minor, in the upcoming session tomorrow and day after. And hope to see you in all our live sprint sessions and make the best use of it. And all the best for the upcoming NEET exam. Thank you.